Hi, my name is Dr. Hilsden, and you're watching my channel, Knife Skills. Today, we're talking about the do's and the don'ts before you have surgery. You yourself, or maybe a loved one, are having surgery coming up soon, and you might be wondering, what should I do to prepare myself for the operation? After all, surgery really is a partnership, both between the patient and the surgeon, and what you do matters. So today I'm gonna give you 5 things that you should do or do not right before surgery. Number 1, don't eat solid food after midnight. Aspiration is the term we use for breathing in your stomach contents under anesthetic, and that is a serious life-threatening situation. So any solid food you eat after midnight puts you at risk. I recently made a video on Ozempic, which talks about the increased risk of this complication and how the guidelines around aspiration prevention in patients who are taking Ozempic seem to be changing. And in fact, the recommendation, if you're on Ozempic, might be to not eat solid food even longer than the night before surgery. Now, you may remember that we used to recommend not to eat or drink at all after midnight, but those guidelines have changed. Now, we recommend that you can continue to drink clear fluids up to about 2 hours prior to surgery. Now, clear fluids really are things like black coffee or apple juice as good examples. If you're drinking juice that has pulp or coffee that has milk in it, that's considered food and can cancel your operation, so don't do that. Number 2, don't shave your body prior to surgery. Now, it's pretty common to have your body hair trimmed in the operating room, and some patients who maybe have more hair might be tempted to shave their own body prior to the operation. But there's actually data to suggest that if you shave your skin prior to surgery, that might damage the epithelium and can increase the risk of wound infections. So our recommendation is to leave your hair alone until you come to the operating room, where the surgical team can take care of any trimming if that needs to happen. Number 3, you should stop your aspirin or blood thinners prior to surgery. Now, every patient and situation may be unique, so make sure you're talking to your surgeon about what you should do about blood thinners. Some patients will need to be bridged, and that's when you stop your oral blood thinners and take injectables up to the operation. And others, you can stop them without having any problem at all. Typically, when it comes to aspirin or Plavix, we recommend that you stop them 5 full days prior to surgery. And if you're on other types of blood thinners, you may have a different interval. So it's really important to talk to your surgeon prior to your operation to know what you should do about your blood thinners. Number 4, brush your teeth well prior to surgery. Good oral hygiene has many important positive health effects. And one surprising finding is that bad oral hygiene can increase the risk of pneumonia in surgery. Longer operations, cardiac operations, and neurosurgery operations seem to be at higher risk of this problem. And you actually might be advised to brush your teeth with a special kind of toothpaste that contains chlorhexidine. Now, this type of toothpaste is in many places only available by prescription, and so that may not be an option for you unless your doctor specifically wants you to use that. But in lieu of this special chlorhexidine toothpaste, brushing your teeth with a regular toothbrush consistently up to your operation can improve your hygiene and reduce the risk of pneumonia. So I really do recommend taking good care of your teeth right before surgery. And number 5, shower both the night before and the day of your operation. Just like with your teeth, showering with a chlorhexidine soap can reduce your risk of infections. And so in some cases, again, like cardiac surgery, your surgeon might recommend a chlorhexidine soap. But without that, using a mild soap on your skin, especially over the area that's going to be operated on, can reduce the risk of infections. And I recommend that you use soap and water in the shower both the night before and the morning of the operation to reduce your risk of infection. Every operation and situation is different, and your surgeon will give you specific recommendations of what you should do prior to surgery. So as a bonus point, I recommend that you read those instructions and really understand what's expected of you the day before the operation. But in lieu of those recommendations, these 5 general principles are helpful on the day of surgery. Once again, I just want to say thank you for watching this video. I appreciate all of you, every single view, like, and subscribe. And if you have any questions or comments or videos you would like me to make, put them in the comment section down below. I appreciate it a lot. And if you'd like to learn a little more about surgery, stick around and watch this video below where I talk once again about Ozempic and its risks when it comes to the operating room. Until next time, have a great day.